Are you struggling to remember the causes and treatment options for sodium disorders? Place. C stands for congestive heart failure. In CHF, the heart is unable to pump blood effectively, leading to fluid buildup and dilution of sodium in the blood. H stands for hypothyroidism or hypoadrenalism. These conditions can cause hormonal imbalances that disrupt the body's fluid and electrolyte balance. I stands for inappropriate antidiuretic hormone ADH secretion. ADH helps regulate water balance in the body, but too much ADH can cause excess water retention and dilution of sodium in the blood. Kidney dysfunction can affect the body's ability to excrete excess fluids and electrolytes, while diuretics can cause excessive sodium loss, or excessive water intake due to psychiatric conditions. Now, for the treatment of hyponatremia, we can use the mnemonic, fluid VAP. F stands for fluid restriction. Limiting fluid intake can help prevent further dilution of sodium in the blood. L stands for loop diuretics, which help remove excess water from the body. U stands for urea, which can be used to remove excess water by increasing urine output. I stands for IV saline, which can help restore sodium levels in severe cases of hyponatremia. D stands for demeclocycline, a medication that can block the action of ADH and reduce excess water retention. A stands for aldosterone antagonists, which can help increase sodium retention in the body. P stands for plasma expanders, which can increase blood volume and sodium levels in the blood. Finally, let's talk about hypernatremia, which is the opposite of hyponatremia. To remember the causes of hypernatremia, W stands for water loss, which can occur due to excessive sweating, fever, or burns. A stands for adipsia, or lack of thirst, which can lead to insufficient fluid intake. T stands for trauma, such as brain injury, which can affect the body's ability to regulate fluid and electrolyte balance. E stands for endocrine disorders, such as diabetes insipidus, which can cause excessive urine output and fluid loss. R stands for renal failure, which can affect the body's ability to excrete excess sodium. So, now you have some helpful mnemonics to remember the causes and treatment options for sodium disorders. What does C stand for in the chirp place mnemonic? That's right, C stands for congestive heart failure. Keep practicing and you'll have these concepts memorized in no time. We will also discuss two mnemonics that are important in understanding sodium disorders. The first is fluid VAP, which stands for treatment options for hyponatremia, and the second is water loss, which stands for potential causes of hypernatremia. Fluid VAP. Fluid VAP is a mnemonic that can help us remember the various treatment options available for hyponatremia. F stands for fluid restriction. When there is excess water intake, fluid restriction can help reduce it and thereby lower sodium levels. L stands for loop diuretics, which can help remove excess water from the body. U stands for urea, which helps to remove excess water from the body as well. I stands for IV saline, which can help restore sodium levels. D stands for demeclocycline, which is used to block ADH secretion. Water loss. Water loss is a mnemonic that can help us remember the potential causes of hypernatremia. E stands for endocrine disorders like diabetes insipidus, which is a deficiency in ADH that leads to excessive water loss and concentration of sodium in the blood. O stands for osmotic diuresis, which can occur due to high blood sugar or mannitol. Finally, S stands for skin injuries like burns, which can lead to water loss from the body and a concentration of sodium in the blood.